Sir? Okay. Hello? Hello, Mr. Wale, good morning.
Yes. Good morning. How are you?
I'm fine. This is Mike. We're testing the lines to be sure that you can hear us and we can hear you.
I can hear you loud and clear.
Great, great, great. All right. We'll shortly.
Thank you.
You're watching TVC Breakfast. Now, with the coronavirus pandemic, it comes a dilemma for HR professionals. Now, the workplace is one of the hot spots for the spread of coronavirus, and employers have a duty under health and safety legislation to take steps to ensure the health, safety, and welfare of their employees. But how exactly should HR respond to coronavirus in the workplace? That is what we'll be looking at in the next couple of minutes now. Joining me on Skype is the President and Chairman of Council, Chartered Institute of Personnel Management of Nigeria, Wale Adeniran. Wale, good morning. It's good to have you join me right now. When we talk about COVID-19 or public health, a lot of people certainly turn to health professionals and what government is doing and essential service providers. But certainly we know that every employer certainly has an HR section that coordinates how people work, how people relate, and how people conduct themselves. Talk to us basically, how challenging is it for HR personnel across companies and across board at times like this?
Thank you, Mike. By the way, my surname is Adediran. Anyway, many people make that mistake of calling it something else. Yeah. Concerning what we, the professionals in HR practice, have to do at this difficult period of COVID-19 pandemic, it's not the best of time for HR practitioners, but it's a huge opportunity for us to provide that leadership that's required at this time of war. First of all, as you've rightly said, we are the custodians of the practices and the systems that ensure that our people, who are the most important asset for all businesses, are in good and healthy condition, mentally and physically. And we all know that COVID-19 is a threat to that objective. So for our people to remain healthy, for them to be mentally sound, so they can be productive at this time, the first challenge for HR practitioners is to allay the fears, is to manage the panic. A mind that is not at rest will not be able to do anything appropriately. Having that, we also need to ensure that the precautionary measures are in place. So on behalf of our employers, galvanizing all in our leadership and in the staffing population, we need to orchestrate the adherence to all the precautionary measures. Those who are not essential for services should be at home. Those who are essential for services should be at work in a way that ensures that they keep social distance, they ensure the hygiene for their hands, they don't touch their faces, they sanitize their hands, and they comply by all the regulations that have been set out by government and NCDC. Apart from that, we need to be prepared in case anybody falls ill. Organizations, employers need to pull resources together. It's a difficult time, oh yes, and many people are not able to run their businesses at this time. But even at that, we need to protect our people by ensuring that we have access to facilities that will ensure that if people fall ill, they are well taken care of. And one thing we've been driving with our colleagues, members of our institute, to ensure this is the time to prepare our people for potential incidents of infection. What do I mean by that? It's the time for people to build up their immunity. It's the time for people to take the quality of food that will ensure that even if there is an infection, their immune systems are able to fight and win the battle.
Yeah, let me interrupt you because of time, Wale, sorry. Let me interrupt you and ask you this question that is a concern of all employees across the board. Now, these are challenging times where a lot of companies are cutting down on expenses. These are times where a lot of companies won't be getting as much money because they won't be doing enough businesses like they used to do. Now, employees, on the other hand, are reasoning and thinking that at times like this, there could be the option of downsizing. Now, as an HR, at what point do you think you begin to consider the idea of downsizing so you can keep up or keep afloat?
This is not the time to cut down on investment on people. This is actually a wartime that demands an escalated level of investment in people. This is not the time for organizations to start considering retrenching or downsizing. This is the time for organizations to focus on how to ensure that their people survive this period. Of course, a lot of sacrifices will be required on both sides, but rather than downsizing, this is the time to invest in the well-being, mental and physical well-being of the people that work in the businesses. It's the time for organizations to find some other means and ways through collaboration with unions where there are unions, through collaboration with the employee representatives where there are no unions, to devise give and take options that will involve sacrifice from both sides. It's the time for that word that we've always been echoing, that people are the most important asset of our organization, should be the dictating principle and should be the driving force behind every action that will be taken. It's a time to ensure that people get through this crisis. There are those who are not working as we speak, but they still have to survive. They have to eat. Even if they don't pay their rent, they still have to pay some bills. Organizations cannot abandon their most important asset at this time. It's not a time for downsizing. It's a time, yes, to manage costs, but it's a time of investment, and it's a time that give and take options will have to be considered by both sides of the divide.
Thank you very much, Wale Adediran. Thank you for talking to us on TVC Breakfast. Now, with the COVID-19 or coronavirus pandemic becoming a dilemma for HR professionals. Now, the workplace is one of the hotspots for the spread of coronavirus, and employers have a duty under health and safety legislation to take steps to ensure the health, safety, and welfare of their employees. But how exactly should HR respond to coronavirus in the workplace? This is part of what we'll be looking at right now. And joining me on Skype is the President Chairman of the Council Chartered Institute of Personnel Management of Nigeria, Wale Adediran. Wale, it's good to have you join me right now. Now, talk to us how critical the area of communication is. We have seen how there is panic and anxiety in the air. Everyone is talking about it. In fact, some people don't have the right knowledge, but they're scared of it. But narrowing it down to the workplace, how should information help in reducing anxiety at times like this?
Good morning, Mike. Thank you very much. Good morning, Mike.
Yeah, if you can hear me, I'm asking, thank you, Wale, for coming on the program. I'm asking that how does information dissemination and how to communicate, how does it help at times like this when there is anxiety and panic?
Thank you very much, Mike. First and foremost, HR leaders are the custodians of the people and the organization strategy in their workplaces. And we have a responsibility to ensure that the people that work in our businesses have the right information that will put this COVID-19 pandemic in the right context. There should be no panic. Where there is panic, you cannot take the right actions. And it is the duty of HR leaders and their executives to ensure that the people that work in their organization have the right understanding of how to be safe, how to avoid the infection, and what to do if there is an infection, and what it means to have an infection. It's not a death sentence, and it can be avoided. So the role of HR leaders is to ensure that their organizations, their workforce, really have a clear understanding that this is not a death sentence. This is an infection that can be avoided, taking all the precautionary measures, and should support the employees to take those measures. There is the other panic of, will I lose my job? This is the time for HR practitioners and the executive members of the various businesses and organizations to step out for the people and to live to the mantra that people are the most important asset by ensuring that we do not complicate the war with fear of job losses. We can engage our people. Yes, it is a big toll on businesses, and it is something that we have to come up with collective solution on. Give and take. That is how we can battle through and have victory over the pandemic. It's not a time to panic, rather, it's a time to have very clear understanding, and it's the role of HR leaders to ensure that employees have that understanding.
Now, Wale, there are some organizations have or employers have a sick bay or a clinic within the organization. Others just have a first aid box or a first aid office and all of that. Now, talk to us how important that is in the workplace, having a sick bay or a mini hospital, as the case may be.
It is very important for us to have protocols to manage cases where there are clear symptoms. And those protocols, which may include isolation spaces, must follow the guidelines set by NCDC. It's important to equip our people with the right information, yes, but to take practical actions to take care of the people in case there are incidents of infection. Some organizations are already partnering with government and with the relevant agencies in the health sector to establish isolation facility to take care of their people, and some to even take care of those who are not their employees. So it is important for employees to have that assurance that their employers are thinking about them. Their employers are thinking about not only their physical well-being, but also their mental well-being. And one way to demonstrate that is to show that they have facility that will take care of the people, both for isolation or quarantine, and even for treatment. And some of our organizations are doing that very well from the feedback we are getting from our members.
Talk to us about some of the most critical precaution when it comes to hygiene that needs to be taken in the workplace right now, from tables to doorknobs to even bathrooms and restrooms and all of that. What should one really look forward to when it comes to maintaining hygiene?
We've all been hearing a lot about personal hygiene, especially as regards not touching our faces and washing our hands with soap and water regularly and sanitizing our hands. And then maintaining social distance. Maintaining social distance should also include protecting others when you know you are already exposed to the risk. Even when you are not sure, it's good to protect others by wearing nose mask, face mask, so that you ensure that in case there's anything wrong with you, You don't get your neighbors, your colleagues infected. Apart from that, the level of cleaning that has to be done in the workplaces now must be escalated tenfold. If people have been cleaning and sanitizing a few times per day before, this is the time to multiply the frequency because now the risk is very high. So it's important that people observe the precautions of personal hygiene around the washing of the hands, sanitizing of the hands, monitoring their personal temperature to be sure they are not having fever or any other symptom like sneezing or coughing. It's important for them to protect other people. When you sneeze or cough, you cough into a handkerchief or tissue that you dispose immediately, or you cough into the fold of your elbow. So people should observe personal hygiene and help to protect other people as well. And the workplaces must ensure that their workplaces are safe by sanitizing more frequently than we've been doing before.
Thank you very much, Wale Adediran, for talking to us on TVC Breakfast.
Thank you.